right, welcome back. We're talking kids with Dr. Caitlynn this morning. Selections and pediatrician, Dr. Caitlynn Iddings.
Yes, and today's topic is carbon monoxide poisoning and using detectors as people begin to turn on their heaters for the winter months ahead. Dr. Caitlynn, good to see you this morning.
Good morning.
This is a topic, that comes up every single year. How do you want to begin this morning?
Yeah, so carbon monoxide poisoning is a very serious thing. It's a colorless, odorless gas, so it's not something that you would necessarily realize what's happening until sometimes it's too late. And so there are about 500 deaths each year from CO
in the U.S.?
In the U.S.,
oh,
yeah.
Wow.
Yeah, so, the big things that we try to hit on, prevention, of course, is the big one. So making sure anything, so carbon monoxide comes from anything that's kind of like gas burning, wood burning, coal burning, sort of anything that's burning, right? I mean, it can come from smoke exposure from cigarettes. It can, those hookahs that people smoke, you can get it from that too. So making sure that whenever you're shifting towards heating your home, that anything that you're using is vented outside, right? So you don't want to have anything that's sort of burning things that's being vented into your home, because that's releasing that colorless, odorless gas that then can be inhaled and cause significant issues. If you have a car that you want to heat up and it's in your garage, making sure you have your garage open or backing your car out and heating it up outside, because again, that can kind of get into the vents and into the home. And kids, because they're so much smaller, are more susceptible to this, right?
Yes.
They breathe faster naturally. Just because they're little, they have to breathe a little more faster to oxygenate, so they breathe in more CO2 than like an average adult, and then it doesn't take as much of it to cause the significant issues for them. So people always, when they start to notice this, they notice, pets, because they're smaller, and kids seem to be more affected than adults at first. And so the symptoms that you would be on the lookout for, it really can present like flu-like symptoms. So kids can be dizzy, they can vomit, they can kind of be, facial flushing, have respiratory distress, like look like they're having a hard time breathing. And like I said, it can progress to where they can, pass out and go into cardiac arrest for adults as well. So those are things that if you're like, my kid's acting kind of weird, now I'm feeling kind of weird, like don't always just assume that it could just, oh, we just caught the flu or something, make sure you think like, oh, could this be going on?
I always heard some of the triggers or symptoms was, you get a bit drowsy, headache. Yeah. All those things are part of it too.
Headache, nausea, drowsy, kind of like someone's intoxicated, right? Like,
oh, okay.
Right.
So you're,
I was talking to a pilot that happens on aircraft on occasion. They have to be very cognizant of that.
Yeah, so anything that has gas or, can burn fuel is gonna, boats can do it. So if you have something in a boathouse, that's something to be cognizant of. And then of course, we want every single home to have a working carbon monoxide detector. So you should have one on every floor. It should be about 15 feet from each room, so that it can be heard if it goes off. And then make sure you're checking those batteries. It was funny, the other night we were sitting there and all of a sudden I hear this beep and I'm like, why does it always happen at night, right?
Oh,
your battery never dies at like noon where you can get it. It's always like 2 a.m. What's that noise? So make sure you're checking those batteries. It's a good thing to check them kind of twice a year. Just make sure that everything's in working order.
Yes, okay. And so what would be your next steps if you suspect there's a leak in your home? Maybe your child is not feeling well, maybe you're starting to feel. What is the first step you do?
So the very first thing is get out of the house.
Fresh air.
Right? Get out of the house, get in fresh air. If you're really worried and they're kind of, not conscious, immediately get to the ER. Sure. Usually the treatment for this is just like oxygen, right? Because basically the carbon and the oxygen are binding to those oxygen receptors, but it's not usable oxygen. So you're basically suffocating because your body thinks, and if you check a pulse ox, it'll be 100%. And they'll be like, well, that's weird. So you sometimes have to draw blood to check that actual CO level to be able to diagnose it and then get them that oxygen that they need.
With the light exposure, as soon as you step out of the house, you feel better immediately.
Yeah, and like I said, if it's just a little bit, then, and that's why it'll be weird. It's like, well, I was feeling really bad this morning, then I left my house, and now I feel fine. Same thing for the kid. Well, they've been kind of complaining of headache and nausea at home, but then they get to school and they're totally fine.
Yeah,
it's very dangerous.
It is.
But if it gets too much, yes, get to the ER immediately. All right, Dr. Caitlynn, good to see you this morning. Thank you. All right, stay with us. We're back in just a moment.